Did you do any monitoring, or are you doing any monitoring
Well, I decided in the beginning to do a urine test. It's called the HCG test.
Okay.
And
what's that?
There's a bit of home chemistry is involved. So you take some early morning urine, you mix it with acetone and 100% alcohol. Okay. You let it sit around for 6 hours, and then you pour it through a coffee filter, and you end up with a dry sample.
Okay.
And you send that off to a clinic in the Philippines, and then they send you a test result.
Okay.
So it's not very accurate, but it's a way of just monitoring whether there is more or less cancer in your system.
So how can they tell that?
So you're aiming for a figure of 50. 50 means no cancer in the system, and anything more than that means you've got circulating cells. So I think I started off at something like 55. I did it every 3 months. It went down to 54.5, 53. Then it went back up to 55. And more recently, it was something like 52.5. So to me, I mean, the figures don't really mean anything other than it's just a scale that's either going up or down. So I found that helpful.
Okay. What else?
I also did thermographic scanning.
Yeah, I know about that one.
Yeah, you do that one as well.
Yeah, I do that one.
So it's a heat camera, like night vision camera, and it picks up heat in the body. So where there's heat, there's inflammation. Where there's inflammation, there's discord in the body. So it's a very good early monitoring system for things like cancer because it can detect inflammation even before a tumour's formed.
Yeah.
So if there's inflammation, it's red or white, and if there isn't, it's green or yellow. So we're looking for green. I think in America they use that quite generally, and you can take it to a hospital.
I think even in Germany, I think it's acceptable. Yeah,
but not so much here.
No,
and it's a shame because there are no side effects because it's just a camera. And it shows an area for concern which an ultrasound would then be used to sort of pursue it further. Yeah. So in a way, it is a much better thing than a mammogram, which dumps a load of radiation in your system and squashes your boobs, which is not good. And the mammogram anyhow only shows a shadow, so it doesn't give you any detail. It just shows you. Yeah. Well, unless the next thing they do is an ultrasound, isn't it?
Then
so it would be nice if they embraced thermography a bit more in this country.
We hope.
Yes.
We hope they do. I've sort of settled for the more conventional type of monitoring systems. So I still do have ultrasound and bone density, blood tests. I have them at the hospital, so it's the more conventional ones. But I'm quite happy with that because at least I'm comforted by the fact that they say it's scientific and it's accurate.
Yes.
So I know where I am in terms of tumor size or whether the tumor cells have circulated anywhere else in my body. So far, so good is contained within the tumor, so that gives me a little bit of comfort.
And are you worried about any of the radiation that's left in your body, for example, when they give you an enhanced MRI or...?
I do, especially the ones where they put a tracer in you and they inject you with this tracer. That worries me a little bit, but I think in my mind I comfort myself with that, the fact that if I know where I am, then that offsets the dangers.
Yes.
But what I try and do is, like, sometimes my oncologist want to send me for so many within a few months, and I do say no because I don't want too much radiation in my system.
Yeah.
So I don't have them too often.
No.
Yeah.